My dear patients and followers, how are you? I hope you are fine. Dr. Özgür Akşan Health Turkey podcast series. We continue from where we left off. Today's podcast series is called Cauda Equina Syndrome, CES. We start now. Are you ready? Empowering patients with Cauda Equina Syndrome. Insights on diagnosis, treatment, and coping strategies. Chapter 1. Introduction to Cauda Equina Syndrome. 1.1 Definition and Overview of Cauda Equina Syndrome. 1.2 Anatomy of the Spine and Cauda Equina. 1.3 Causes of Cauda Equina Syndrome. 0.4 Symptoms of Cauda Equina Syndrome. 1.5 Importance of Early Diagnosis and Treatment. Section 1.1 Definition and Overview of Cauda Equina Syndrome. Cauda Equina Syndrome, CES, is a rare but serious medical condition that affects the nerves at the base of the spinal cord. It is caused by the compression of the nerve roots that make up the cauda equina, which can result in a range of symptoms such as severe pain, weakness, numbness, and loss of bladder or bowel control. CES can be caused by a range of factors, including disc herniation, spinal stenosis, trauma to the spine, tumors, and infections. Early diagnosis and treatment are crucial, as delayed treatment can lead to permanent nerve damage, paralysis, or even death. Treatment options for CES can vary depending on the severity and cause of the condition, and may include surgery, medication, physical therapy, or chiropractic care. Section 1.2 Anatomy of the Spine and Cauda Equina. The spinal column is made up of 33 vertebrae that are stacked on top of one another and separated by intervertebral discs. The spinal cord runs through the center of the spinal column and is responsible for transmitting signals between the brain and the rest of the body. The cauda equina is a bundle of nerve roots that extend beyond the end of the spinal cord and into the lower back. These nerves are responsible for transmitting sensory and motor signals to the legs and feet, as well as controlling bladder and bowel function. The cauda equina is located in the lumbar region of the spine, between the L1 and L2 vertebrae. Section 1.3 Causes of Cauda Equina Syndrome. CES can be caused by a range of factors, including disc herniation, spinal stenosis, trauma to the spine, tumors, and infections. Disc herniation occurs when the soft, gel-like center of a spinal disc pushes out through a tear in the outer ring and puts pressure on the nerves of the cauda equina. Spinal stenosis is a narrowing of the spinal canal that can compress the nerves of the cauda equina. Trauma to the spine, such as from a car accident or fall, can also cause CES. Tumors and infections that affect the spine can also lead to CES. Section 1.4 Symptoms of Cauda Equina Syndrome. The symptoms of CES can be severe and can include low back pain, leg pain, numbness or tingling in the legs or feet, weakness in the legs, loss of bowel or bladder control, and sexual dysfunction. In some cases, patients may experience sudden and severe symptoms, which can require emergency medical attention. It is important to recognize these symptoms and seek medical attention immediately, as delayed treatment can lead to permanent nerve damage, paralysis, or even death. Section 1.5 Importance of Early Diagnosis and Treatment. Early diagnosis and treatment are crucial for patients with CES, as delayed treatment can lead to permanent nerve damage, paralysis, or even death. Doctors will typically perform a thorough physical exam, take a medical history, and order imaging tests such as magnetic resonance imaging, MRI, or computed tomography, CT scans to identify any potential nerve damage. Treatment options for CES can vary depending on the severity and cause of the condition, and may include surgery, medication, physical therapy, or chiropractic care. Patients may require ongoing care and rehabilitation to manage their symptoms and prevent further complications. Support from family and friends as well as medical professionals can be essential for patients with CES. My dear patients and followers, we finish our podcast series here. Keep listening to us. Contact us now to start your neurosurgical treatment journey in Turkey. Don't forget to follow us on social media to hear about the news on neurosurgery about Dr. Özgür Akşan Health Turkey. For a healthy future, greetings from Izmir, Turkey. Goodbye.